Thank you, Chairperson, and all distinguished guests. Before I talk, I have to show my great thanks to the Professor Ta-Chan to invite me to here. This is a wonderful experience to the first time to the Myanmar. And today I will talk about that this endocrine disrupting chemical and the risk of type 2 diabetes and cardiovascular disease. And I focus on the PFOS and Phthalates exposure. There's no conflict of interest to declare. This picture that I think this is my childhood. However, nowadays we go to the seashore. This is picture. So in the 1962, the Silent Spring, this is very important for the United States for the environmental protection activity. Now we are facing the stolen future. So this is a picture of the increasing in prevalence of the diabetes in the United States. And I think in Asia area, particularly in the southern East Asia, in next 20 years maybe it's double times. So it's a very high prevalence at here in this region. How about the endocrine disrupting chemical and the cardiovascular health? In 2010, the American Association still not clear. They just say that the obesity is clear. However, other kind of the health or cardiovascular disease is not clear. So they say that need more study to investigate this kind of association. And type 2 diabetes, from a review article from the EHP, they say that the smoking is clear. Arsenic and PCBs and POPs and phthalate and bisphenol A. This is some more evidence has been clear. So this slide is showing that the arsenic exposure and type 2 diabetes, we can find the trend of increase in the odds ratio of the exposure, that the risk of the diabetes is increased. And this showing that the PCB and the type 2 diabetes, and we found that the trend is of risk is increased also, but not so clear as the arsenic, however, is increased. This is one study in Taiwan that is in 1979. About 2,000 oil disease victims, they are exposed to the PCBs and their heat degradation products, that the PCDFS is the dibenzofurans. After the 24 years later, and we found that the 5.5 risk of the type 2 diabetes. And this is our recent study. We are to study the effect of the bisphenol A exposure and the risk of the subclinical atherosclerosis. And we measure the subclinical atherosclerosis in the carotid intima medial thickening over the right, the common carotid artery and valve and ICA. And we found in different segments of the carotid arteries, we also found who can be detected with the bisphenol A, the CIMT will increase. So how about the environmental exposure and the endocrine disrupting chemical can be categorized at here. This is 2009 in the Stockholm. They have a consensus to declare.
CFM, caring for well-being.